Well, you've certainly run the gamut over your years as a surgeon, as a urologist, which was your initial area of expertise.
Yes.
Where do you see your career in medicine going to best serve people, whether it is in the field of urology, oncology, urology, and moving forward, prostate cancer? If it is in the mix, where do you envision yourself basically in the next 10 to 15 years? The magic $1 million question.
Well, I've had, I've been very fortunate because I think as a physician, number one, you have to love what you do. And I truly care about my patient. It's the success of making sure that the cancer is gone. When you see the wives, when you see the daughters, the hugs that comes after the surgeries, the fact that you've made a huge difference in people's lives. And I can tell you that, we're in Madison Avenue, and if we walk for the next 3 blocks, you're going to see one of my patients that will call our name and say, "Hey, I love you, and you saved my life." There's no price for it, and I get a lot of satisfactions out of it. I have a beautiful family who you can imagine getting up early and late hours and the commitment to the patients. Very supportive family, and that has been tremendous and part of my success. I also want to give credit to the team, both in my office and in the operating room. Having your own baseball team, people that are always with you, they know exactly what their position is. They also want to be part of that success of taking care of these patients. It's been a very gratifying career for me. As a chair of urology at Lenox Hill, my goal would be to really develop one of the best departments in the world. We're going to commit ourselves not just to oncology, but also to pediatrics, to female urology. Our endourology program is very successful. The kidney cancer program is growing rapidly. And I tell you that so far my at least presence at Lenox Hill has been a great partnership. They appreciate what we do for the patients. They have created a home. We have the most private concierge floor that's developed at Lenox Hill. So, and if you would ask me, you as a chair of the department, why are we in this center here? And the answer would be that I don't want my patients to feel sick. Prostate cancer has no symptoms. So I think the concept of seeing men in a prostate cancer center or institute or a cancer center is not a good idea. They will be exposed to the patients with leukemia, with liver, to jaundice, to pancreatic. I want to completely distract them, see them away from the cancer center. I want to do this fancy operation which takes only about an hour. They go to this beautiful floor and then they go home. The fact that they feel that they have no cancer and they leave thinking, you know what, this wasn't so bad. I've done my job. The result is superb. We have 90 to 95% cure rate. And the great thing about surgery is that as time goes on, the recovery gets better and better. That's one of the reasons why I favor surgery, not because I'm a surgeon. Cancer doesn't belong there. You get the cancer out, and I only use radiation after surgery. I'm sure you know that if you do surgery, you can always give radiation after that. But when you do radiation as a first line of treatment and the cancer comes back, it would be very difficult to do surgery. And that's something that a lot of people may or may not know. So where's my career headed? We're having an amazing time. Patients are coming from all over the world with good outcome, and we're going to continue to grow this and bring more talents in different fields so they can have similar career.
That's wonderful. What a pleasure, Dr. David Samadi, my guest today. Thank you very much.
Thank you very much.
What a pleasure.
Thank you.
So much.
Pleasure.